Hello. Today, I'm really looking forward to this conversation actually, because it's going to be something I feel that is just going to help us unravel and ourselves and think more about ourselves during this time that we're going through, whether it's perimenopause, menopause, or post, but also even before, if there's anybody who's listening, who's going through any stage of life actually. And I think this is really important. So the topic today is menopause choices. So it kind of leaves itself wide open. And I'm joined today by Zoe, and I'm going to let Zoe introduce herself to us and tell us who she is, what Zoe, what you do, so that you can share that with our listeners, and then delve a little bit further because I'm excited about this. I love choice. I think it's so important. So Zoe, welcome to the podcast.
Thank you so much for having me. I think it is so important as well. So I'm really delighted to be talking about it. So I'm Zoe Schaedel. My background is as a GP. I'm also a menopause specialist, and I'm the co-director of a women's health clinic called Myla Health. I also lead an NHS menopause clinic in Brighton and Hove. And I'm really involved in trying to educate women, but also clinicians about the menopause. So I work as a facilitator for the British Menopause Society, and I sit on their medical advisory council.
Lovely. Gosh, wealth of knowledge, wealth of experience. How amazing. I have been actually following what you've been doing on Instagram. There's been some stuff going on as well. So that's been really interesting. Yeah, so thank you for joining us. We're really, honored to have you on here, and it's wonderful. So when we were having just a little bit of a chat before we came on, and I was just sort of asking, why that topic? Because my standpoint is, and even when I went to the APPG meeting and I was sitting there, that's twice now I've been and invited, and it's been really a privilege. But for me, it's just about choice. And I don't feel that women have a choice. I don't think that for menopause, I'm talking again, we are specifically talking about menopause. I don't, again, I feel that choice is being removed away from us because it's people fighting for, no, it's got to be HRT. No, it's got to be this. No, you've got to go the natural way. How could you go to HRT? So you're again caught in this, no, you've got to take that vitamin and you've got to take that supplement. And because a celebrity is doing something, we've all got to do it and it's got to be right. So again, I feel like that space is just being invaded by what you should be doing and somebody telling you what's right for you. So just a total advocate for people understanding that we are all completely different and unique. There may be some common threads running through, but we need a choice. So explain what you mean, Zoe, by choices.
Well, I think exactly as you said, there have been various things through the years that have really influenced women and what they think they should be doing. And it's that word should, isn't it? We really want to eliminate that and just try to understand what's right for the individual woman in front of you, because everybody is different. Everyone has different backgrounds, health issues, beliefs, values, their experience of life, what's happened in their family, their culture. And all of those things will fall into that kind of decision making about how to manage your menopause. And what we really want is women to feel empowered, really empowered to make the right decision for them. And the only way they can do that is to understand all the options. And that's why it's so important for me. It's that it's not one thing, and that different things will be right for different people. And I think it's interesting because now you're talking, there's been this amazing media kind of coverage of the menopause, which is so wonderful, and women's voices are being heard, and that is so important. But then when you think about 20 years ago, there was a kind of different media influence, and people were hearing that they shouldn't have HRT and that it was dangerous and all of those things. And actually, all of this really puts pressure on women, in one way or the other. And like you say, sometimes now women feel the pressure that they should be having HRT. And I certainly see women in my clinic who come in and say, well, I wasn't going to, but now I'm hearing all this stuff about it. And should I be doing that?
Yeah.
And I think it's so important that, I suppose, our job as clinicians, health professionals, is to really give someone the knowledge that they need to make the right decision for them. So it's trying to pick apart all that. It's trying to say, well, what is your experience? What's important to you? What do you want right now? And take away all the shoulds and really, give them the information, because I suppose my job is to be as expert and knowledgeable as I can. So I can really, answer the questions, bust some of those myths, really
Yes.
try and help so that someone has the right kind of grounding to pick what's right for them. But my job isn't to say what they should do or to influence them. It's really just to kind of pick those things apart, and then they have to look at it and, based on what they want and what's right for them. And I think that is the whole job of a consultation around menopause.
Yeah, you're so right. And again, as you are experiencing, I've experienced the same thing. Where when I first started the program that I created and all of this world that I'm now in, never expected to be here, but being here, there was this not having HRT because I am going to get cancer and I'm going to die. That was the first thing, right? That's when sort of 3 years ago, that was the rhetoric, and we're getting a little bit of that, but now I'm getting a little bit more of, if I don't have HRT, what's going to happen to me? I'm going to get really sick. I'm going to get really ill, and da, 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 da. And it's almost, again, it's that fear, it's that scaremongering. And I think exactly as you said, that the the role of those of us who are in this space is about providing people with choice. And you're so right, because for me it's very much about, again, busting those myths, saying, actually, no, that's not right. Let's just break it down into this, into this, into this, into this. But I suppose the the difficulty lies in the fact that there are so few of us. Now, I'm not medically trained, I'm not a medical practitioner. However, I still classify myself as an expert on menopause, just simply because I've got a lived experience of it. I've been doing 14 years, now I'm postmenopausal, and 10 years of perimenopause, and I've done everything I possibly can, and I know that the work that I'm doing is helping others. So there's 60 women that have been um, had a significantly positive impact by what I'm supporting them with. So I do call myself an expert in that field. However, I just think the difficulty lies, I mean, I don't know what you think, in the fact that there aren't enough medically qualified clinicians who are experts. Now, that whether they're nurses or doctors or whoever, it just doesn't matter. What do you think about that? Is that a challenge for you?
So I suppose this is an area I'm really passionate about, because I spend a lot of my time teaching clinicians about the menopause. And I think it has improved hugely. So
Yes.
I think if we were having this conversation 5 years ago, I would have said it's dire, people really don't understand. They really, but what I think is a result of so much, media and the menopause mandate and what's happened politically, has really influenced medical professionals. And I think that I've seen a huge increase in the number of clinicians that want to be educated. So in our area, so in Sussex, we do training for clinicians nearly every week, because so we have the mental health services asking us for training. We have the hospital, all of the local hospitals have asked us to come and speak to them about menopause. And the GP surgeries invite us in really, really regularly. And there's such an appetite for it. And I think before, it really wasn't part of the standard training. Certainly when I was at medical school, I think we had about an hour on menopause, if that, and it didn't cover anything that I need to know now. But things have changed. And I think people are really keen. And there are waiting lists for all of the courses that I facilitate. There are waiting lists. So we know that people are really keen and they can access much more information. So I think it's changing. Of course, I still hear stories from women who
Yes.
don't manage to connect with a clinician who is well educated. But I often see women who've actually been given some good advice. So I hope it's changing. I think the other thing is about time. And I think in order to have good options, and make good choices that are right for you, there's quite a lot that goes into that, isn't it? When I'm talking to someone, I'm listening out for clues about what is going to help you here. Are you fearful because of your family history? Are you worried about how natural something is? Are you worried about the risk? And I'm looking out for that, and then I want to be able to give the right information. And then the patient themselves would have to receive that and kind of process it and then come back with their questions and answers. And 10 minutes in a GP surgery, it's really hard to do that and to give someone all of the options in the way that's right for them and their values and their experience. So I think expertise is improving so much. But I think time is an issue. And I think that I suppose we all have to take a role in making sure that women go as prepared as they can, but
Yes.
also with the expectation that it might need more than one meeting or one consultation, or to go away and perhaps be signposted some information and things like that. So I think that's part of the issue with options is it's time consuming to really get into that with someone, and our current medical system and the pressures that primary care under does, I think, makes it challenging.
I think you hit the nail on the head, very much so. And I think even if you were to go up to 2, 3 years ago, again, when I sort of started on this, um, absolutely no one, doctors, it was just a horror story every time you spoke to a woman who had gone to her GP, and it was that usual scenario of being prescribed antidepressants, then prescribed painkillers, then hysterectomies and all sorts of things that just was completely potentially unnecessary, potentially.
Yeah,
That has changed. You are right. It is beginning to change very slowly. And I think, again, one of the things that the report from the PPG meeting inquiry into menopause brought out was that education needed to be brought into the medical courses, and actually that there should be more interest in that, and that should become mandatory. That has to happen. And yes, you're right, there is a shift. Yes, you're right, there is a change. But again, actually, there just aren't enough. Even if the GPs, I think, just have a lot on their plate. I just think, exactly as you said. So when a woman goes into the GP practice and expects the doctor to understand, the GP to understand, that one of the things I always say to them is, ask your GP practice whether there is a specialist nurse or a specialist doctor that will be able to help you with menopausal women's health. And quite often they'll come back and they'll say, no, there isn't. And then it's like, okay, well, where do you go from there? So it's almost like, there aren't enough clinics. One of the things I was very keen to ask for was that there should be specific clinics or community support systems where women could go to get the help that they needed. And it's a holistic approach. That's the other thing that worries me, is that and GPs aren't, they're not meant to know everything. And again, people will go in and go, right, well, they didn't tell me about what I should be eating and what I should be exercising, what I should be doing. I was, well, they're not going to know that. They're general practitioners. They're dealing with your medical issues, which they're not being taught about the other side of stuff either. So, there's this whole, it's like this thing, yes, it's getting better, but actually as an individual woman on the street, there's
yeah,
several things that are not happening. There's just no dots being joined up anymore.
yeah,
And I do feel their frustration when I hear it.
totally.
So whilst we want the choices, which
Yes,
is what this is about, you know, and you're educating the clinicians and you're trying to do that side, I'm working on the other side where I actually think women, and you're doing that too, but it's brilliant that your focus is on that. I'm trying to get women to understand that actually they do have control. They can make those choices. But I
yeah.
would love to hear from you what you feel is the right approach to being able to have those choices as a woman who is going through, or you think you might be going through, perimenopause or menopause.
Yeah, yeah. So I think you're so right. So I think that to have the options that isn't just HRT. So you're really saying, look, actually, even if people do manage to connect with someone that can really give them good advice, often they're not really told about the whole picture. And of course, again, there's lack of knowledge there, and there's probably time issues there as well. But this is so important. So you can't have a conversation, in my opinion, about the menopause or the perimenopause without talking about the fact that there are lifestyle changes that you can make that
Yes.
can really influence how you feel and how you're going to thrive or experience the perimenopause and menopause, and also might contribute to your longer term health. So that's incredibly important. In fact, we've just, we've recently had this Brighton and Hove Menopause Clinic commissioned. And again, it's a really lovely change, because a few years ago when I tried to do that, it was a no. And now we've now got it, which is really wonderful. But when I hear people call it an HRT clinic, I bristle, because it's not an HRT clinic.
No.
It's a menopause clinic. And actually, we want to work for all of the options. So there's always an option to do absolutely nothing, to have no treatment. That is always an option. And we really need to talk to people about that. Of course, there are some women who are really suffering, and they are so worried about these kind of perceived risks. And so we really want we want to bust those myths, and we want to say, no, absolutely, HRT could be safe for you and life-changing. And, but actually, for some women who aren't particularly symptomatic, they may choose not to take HRT, and we've got to make sure they see that as a real choice. And there are things they can do in their diet and their lifestyle that can be incredibly helpful. And I think actually, sometimes people are really surprised to hear that, and they think, oh, actually, are there things that I could do to influence my symptoms and my experience?
Yeah.
And yes, there are. And also, they will help you with your longer term health as well. And I think we really need to move away from that fear, exactly as you said, which is, if I don't do this, what's going to happen to me? Am I going to be a crumbly, heart attacked, ancient woman at the end? And there is so much we can do in this time of the perimenopause to really prevent that. And so I think all of those things are so important. I think it's always trying to, in a clinical situation, it's trying to work out what is holding you back. What are the things that might help you, and what's holding you back from that? Is it what your friends are experiencing? Often it's something someone has held on to for a really long time. So perhaps someone's told them that HRT wouldn't be allowed for them. So that's something I see all the time, is someone was told 5 or 10 years ago that because they had a blood clot, because their mother had breast cancer, because they've got high blood pressure, whatever it is, that you're never going to be able to have HRT. And so when they suddenly see it as a possibility, it's really hard to move out of that space. They've really internalized this, I'm never going to be able to have it. Or the opposite, someone I saw this week, she came in and she said, I'm really here just because my friends have all said I should get onto this.
Yes, all the time.
And they really think this is brilliant. And you say, well, what is it that you want? Let's really get to what is it what's worrying you? What's trying to, not really very much. She was a bit grumpy. She said, I'm a bit grumpy sometimes, but she actually said, I actually quite like being grumpy. I feel like I can just be quite authentic sometimes. And
and I said, well, I call it exactly. No filter.
Exactly.
Say
it. and she decided not to have HRT. And the other thing is, sometimes I really feel like I just need to lighten the decision for someone. So it's built up as this really big thing, isn't it? It's this life, I'm going to be on HRT for life, it's going to be this huge thing. And actually, you could try it for 3 months, see how you feel. You're unlikely to have any risks over that 3 months time. And then you can decide, can't you? Do you feel good? Don't you? And just make it a lighter thing. It's not a big will I, won't I, life-changing decision.
Yeah, you're so right. And it's really interesting. Yeah, you always get but my friends said, or my friends are, or, the pressure I hear quite often is the other way. It's like natural, I've got to do it naturally. And I said, so your hormones are natural, right? Your hormones shifting during from the point of puberty onwards till now. It's a natural process, exactly, but it doesn't necessarily make it very pleasant for everybody. Everybody has different things, and exactly what you're saying about that lady who was just feeling a bit grumpy and nothing else. Actually, just doing a bit of exercise could, if she wanted to relieve the grumpiness, it could help her feel a little bit lighter, a little bit better. And there really is, I think, that balance to be had. And what I'm also seeing now, because a lot more women are having HRT and exploring that option, which is fantastic, I'm also seeing the other thing where they're saying, yeah, but it's not, I'm still getting this and I'm still getting that and I'm still getting that symptom. And I'm saying, okay, HRT isn't this magic pill that you just take and actually everything suddenly is absolutely hunky-dory and wonderful. You still need to make those lifestyle choices. You still need to make those lifestyle changes, because you're going to be in a menopausal stage or state for anything to 30 to 40 years. And even when you're postmenopausal, and as I'm finding out, and and I know it because I've kind of looked at it in more detail, your symptoms don't necessarily stop. your risk doesn't necessarily reduce. Your risk to osteoporosis, your risk to diabetes continues to remain remain there, because of those, the changes in the loss of the estrogen and type of estrogen and the progesterone and testosterone all changing around. So people quite often go, well, I never had any symptoms, so I'm going to be absolutely fine. And then I hear people now, some women have approached me in their 60s and said, I'm diabetic, but I eat really, really well. How is that even happening? Or I've got high cholesterol. So, it is, I think, something that we shouldn't be thinking about, as you said, make it lighter for sure, but it's not also something we should just be thinking, right, HRT plaster, off we go, you
Yeah,
know?
I think it can't just be one or the other, can it? Because
No.
if you're going to use HRT, and I suppose the risk is sometimes women kind of feel like, all right, I've got the HRT, that's going to sort out all my risks and my
Yes.
symptoms, and then I'll just kind of, and I think also it's so tempting, isn't it? Because lives are really busy.
Yeah.
And I think it is, we see all the time, women at this time of life are under a huge amount of pressure, and their time to look after themselves is very, very limited.
Yeah.
And so if there's an option to take a slightly easier route, which some people might find HRT that, then they might choose it. But like you say, it has to be done together. It doesn't work like that. Like you say, it doesn't always cure everything. It's not always as life-changing. Some women experience it like that, and that can be a very powerful message to hear. But it doesn't always behave like that for people. It doesn't always do that. And
No.
also, if they don't attend to their lifestyle and their diet, all of those things will impact on them over time. And
Yeah.
it just isn't giving them the best chance to really thrive, and
No.
I think it's so important.
Yeah. Yeah. You're totally right. It's just a brilliant, brilliant conversation. Thank you so
I
far.
think the
I've just
other,
loved it.
yeah, I just absolutely, as you said, the two things I will always try and gently challenge a little bit if someone is able to hear it is that natural thing. So someone might say, but I want to do it naturally. And I will always say, well, what does that mean to you? Let's
Yeah.
actually look what it means to perhaps take some of the supplements you can buy over the counter that aren't necessarily bad, but this is what it means. They're not regulated, and they
No.
might not have the health benefits that HRT.
No.
Just see compared to the hormones we have. And I'd always challenge that. And the other thing that I think is a bit marmite, I do sometimes try and gently challenge in the right way, is about the Mirena coil. So
Yeah.
that's a really interesting one, because for some women who have terrible bleeding problems around the time of the menopause, the Mirena coil can be brilliant, and it can be a fantastic component of HRT. And almost, depending on the person, it's very common for someone just to say, oh, I would not consider that. I just would not consider it. It sounds awful to me. And I'll always just say, look, that's fine. That's completely fine. But could I just tell you a little bit about it? Because sometimes people hold these real myths about the Mirena, and
Mhm,
it's
mhm.
just making sure that I've addressed those little concerns, because I will always agree it's quite painful to have it inserted, and if that's a barrier to you, don't do it. But sometimes people worry that it's going to be kind of stuck inside them and they won't be able to have it removed if they didn't like it. And it's actually really easy to take it out. It's quick. That actually isn't a bad procedure.
No.
Whip it
No.
out really quickly. And also, it does have this benefit of
Yeah.
protecting the lining of the womb
That's right.
whilst usually stopping your periods. And that can be, again, that can be life changing for women. They've put
Mm.
up with such awful bleeding. And sometimes people say, look, this is just not for me. And I totally get that. But sometimes they might say, okay, maybe this is something to consider. And again, it's just about options, isn't it? It's just
Yes.
having it all out there, and knowing there are things that might help you. They might fit in with the way you want to live. It's just making sure you understand them all.
Yeah. Yeah. No, you're absolutely right. And I love that challenging, because I do exactly the same thing. That whole thing about, um, you know, um, I want to do it naturally. And then, you were spending so much money on all these supplements. And I always say to the women that say that to me, and I have, and absolutely that's your choice. It's not a problem. But I always say to them, do you know that you need that? Oh, what do you mean? I said, well, do you know you need even something like vitamin C? Do you know you need vitamin C? Is there, well, what's telling you need vitamin C? Well, my friend's taking it and she said it's really good. Or somebody's taking black cohosh, or someone's taking some ashwagandha, whatever it is, whatever they may be, supplements, or a multivitamin for menopause, whatever it may be. just like, so how do you know you need this? And I'm like, well, I don't know. Like, okay, so there's no, you haven't had a blood test that tells you what's going on. You haven't had any, anything that's telling you that this is what you need. So I just think sometimes we are, as you said, very quick to do things that perhaps work for other people. And I always say that, even when it comes down to the minute thing of food and exercise, the food you eat what works for you is so individual. you know for example, somebody will say to me, oh my God, you don't eat, like, oh, you're not eating rice and and chickpeas and grains and things like that. I'm like, no, because it makes me feel really unwell, and it bloats me, and it makes me feel awful. However, I know exactly what I can eat in order to make sure I'm not missing out on any of my nutrients and actually packing my meals, my food up. And that's why I did all the research I did, because it's just so important for me to understand my body and how my body reacts. So I just think, again, getting women to understand that they are unique. Yes, there's a common thread that runs with us all, because there is that change happening from fertile to non-fertile. But that journey is so different for all of us, and having that choice. I just kind of, we're kind of coming sort of to the end of our discussion. The only reason we keep these discussions, by the way, Zoe, to about 30 to 40 minutes is because, as a menopausal, now postmenopausal woman, my concentration span is quite small. So
Yeah.
actually, I lose interest by about 30 to 40 minutes. So I actually
Yeah.
keep all my podcasts. I know podcasts go on
Yeah.
for an hour sometimes, but I actually keep them short and sharp and snappy,
Yeah.
because I just think just enough time to get that information into you. But I think the other thing that I wanted just to raise, because I know you're in that field where you're um, teaching others,
Mhm.
is representation. And I know we could have a whole conversation about this, and we've got
Yeah.
about 5 minutes, but I just wonder what you feel about representation, because to me it matters. The women I work with predominantly are South Asian, they're
Yeah.
Asian, they're Indian, but I see some of it, I don't see a lot of it. And
Yeah.
our experiences are very different culturally and emotionally.
I think this is hugely important. So I think this is, I suppose, um, this is in a small way all about including the people that you're working with in the decision making around how you're going to do it. So
Yeah,
to me, it talks to involving women in everything we do. It is not up to doctors to
no,
decide what is right for women. It is up for
yeah,
women to decide. And again, when you have all these cultural differences and different understanding of menopause and women's health in general in different cultures, that we can't say what's right. We have to ask the people themselves in those cultures. And actually, I've seen it really firsthand. We do lots of talks to community centres locally. And I was in a talk quite recently, and there were people talking throughout it, and I couldn't quite see who it was, and actually someone had brought along a translator, and it was so wonderful. And I thought, oh, of course, like I'm going into this community, but I'm talking a language that they don't understand. And actually, they wrote to me afterwards and said, look, what the people really want in this community, what the women would like, is actually to have some proper written information that they can read and understand. And you know what they were all saying? Why has no one told us about this? And they were
yeah,
really surprised to hear any of the things I was saying about menopause. It was just
yeah,
a general menopause chat. So why has no one told us about this? And I think also perhaps a little bit suspicious of what I was saying, because
yes,
it was so new, new
yes,
information to them. But they said, send me the information that you have. And I felt really underprepared that I didn't have it in different languages.
no, no,
And also I could tell that this was going to be part of a sort of thinking, they're not, they need to have all of this information in a way that's right for them.
yeah.
And so actually, we've involved our local CCG in trying to translate lots of our information and try to reach different cultures. But I suppose that is why representation is so important, because I turned up with a really good idea of what I thought was great information,
No, and
and
it would have gone.
cannot reach them. Yeah, exactly.
And
And
it's, it's a simple things, and I would love to help you on this if you need any help,
yeah,
because
oh yeah,
I actually go out. I'm going to doing in current conversation with somebody in Bolton, and I'm talking to somebody. I'm going to a Gurdwara in Birmingham, in Coventry. So for me, it's hugely important, because the being able to be relatable is really, really important. And I'm so glad that you've experienced that, and you're working towards that. And I would love to chat with you a little bit further about that as well, actually, because for me it's hugely important. That's why I'm doing what I'm doing, because there is, I have a wonderful team of people that will help as well in terms of translating. But for me, it's hugely important. Again, it's what I said to the Parliament. I said, you are missing out. You're talking about, sadly, the average white person, female, middle class, whatever you want to call it. And that is just
Absolutely.
not our demographic in this country at all.
At the moment, the menopause conversation, which I think is wonderful, is not for everybody, and
No.
we need to make it for everybody. And we know that the links between deprivation and menopause care, there are this stark
Yes.
relationship between being more deprived and poorer and not having access to good menopause care.
No.
So we know that it's not reaching everyone. We know there are these cultural differences, and I think that is really where we should be working now.
Yes.
But
100%.
this is the kind of this is now the space we need to be improving
Yeah.
things in.
Yeah.
And
Totally.
I think it's huge. So I'm really glad you brought that up because, like you say, options the options have to be able to be received in that person in their space with their background, and we need
But
to find ways of making that accessible.
exactly, but before you even start that conversation is the conversation about being able to open up about women's health in that culture, in that arena where women's health is just not spoken about at all. It's you are the bottom of the pile. If you are feeding a family of 10 people or whatever it is, and you've got your mother-in-law and your mother and your kids and your husband and whatever, and you don't even, your periods aren't even discussed or talked or relevant, let alone menopause. You suddenly have to start from that angle,
Mm,
bringing it in. But
yeah.
I am, Zoe, I'm grateful that we're having this conversation. I'm grateful that you are recognizing that as well. And actually, I have learned an awful lot about what you're doing. I think it's amazing, and I really hope that you continue, because we do need to have every single person, clinician in the country, being educated, and around the world too. Um, we are, sadly, conversation to come to an end, because I could literally, that was just like a start, wasn't it, of conversation, and I
Yeah.
just like, oh gosh, okay, but we're running out of time, and I really want to allow you to be able to share where people can find you and the work that you're doing. But before we go, a really quick one that we asked all our guests was if they could actually share something that they cherish, a routine or a ritual that they cherish, or they practice, that may help some of our listeners as well.
Okay, so I thought about this because I knew you were going to ask me, and I thought, what is the thing that really makes the difference to me? And it's probably what other people have said, but I'm actually a real fan of mindfulness. I'm a massive convert. I used to hate it. I used to be the person in yoga who had hated the bit where they made meditate and got me really agitated. But now I see it as a massive time I can just have I think of it as a brain break. So my mind is very busy. I'm a very busy person, and my mind is always thinking. And if I don't take a little bit of time where I'm not thinking and processing and planning and sorting things out, I just don't feel good in myself, and I lose clarity over what I'm doing. So every time I go for a walk, I have dogs. Every time I go for a walk, I used to use that as thinking time. And now I'm
Mm.
very strict. I say I will not think on my daily dog walk. I will not think. I will just be in the space. I just be. And I use those little tricks like 5 things you can see, 4 things you can hear, 3 things you can, that kind of thing. And that just makes me feel really present. And I will have thoughts that interrupt me. And then I make myself go back to the beginning, 5 things that I can see. And I do a whole dog walk like that, really. And I think that's what really keeps my brain focused and fresh. And I really need those breaks in my life. So that is what I do.
That is super helpful. I love that. I think I'm definitely going to take some of those tips from there, because I hadn't thought about that. 5 things, 4 things, that's lovely.
Yeah.
And I'm
Yeah.
definitely going to try and use that, because you're right. A brain break sounds fantastic,
Yeah.
and really useful. Thank you, Zoe. Just to finish off, where can people find you?
So over at Myla Health, we're at Myla Health on Instagram. I'm also Zoe Menopause Doctor on Instagram. And Myla Health is at mylahealth.co.uk.